I will. I think, yeah, it's 11. 11:01.
Okay. Okay. I received a request from your class. Some students, they came to me and they asked for the student formulary for antibiotics, especially cell wall synthesis inhibitors and protein synthesis inhibitor from Dr. Hakim's lecture. Do you want? So by now you must have realized that I am the kindest person. I am very kind. No? So I am very kind to you. So there is a student formulary from his three lectures. So,
oh my God, it's increased.
no, it is.
Oh. Yeah, they actually have decreased. Yeah, but there's a new one. No.
Which one? Which one?
Yeah, septidine.
The new?
Yeah,
Okay. Since I am the kindest person, remove it. Okay. Anything else? Separation, he said.
yeah, was it?
Which drug you didn't like?
What did you think?
We didn't take it.
That's what.
It is
That was
now reasonable. Let's say.
and Cytoxin.
Yeah, it's also.
Okay. Now let's move. We are now going to very important lecture of autonomic nervous system. Let me warn you about this system, autonomic nervous system, that it will come again and again in almost every block from now on. The next 4 lectures are based on today's lecture. Cholinergic agonist, antagonist, adrenergic agonist, antagonist, and the whole CVP block, respiration, heart, blood vessels, kidneys, everything will be GIT, everything will be based on today's lecture. So autonomic nervous system is extremely important. What we are going to learn today will discuss the autonomic, anatomic, and functional distribution of nervous system. Please sit down. Hello, excuse me. What is the problem with you? We have started. Okay. And I am using mic so that you can listen. Compare and contrast the somatic and autonomic division of peripheral nervous system. I'm using so many abbreviations in this lecture. Peripheral nervous system. Compare and contrast the receptors, neurotransmitters, and function of sympathetic and parasympathetic nervous system, which are part of the autonomic nervous system. And finally, describe the steps in neurotransmission in sympathetic and parasympathetic nervous system. Okay, before moving to the lecture, this is the prologue of the whole lecture. You are on a safari in South Africa or Namibia or Zimbabwe, whatever. You encounter a lion. You are going and you encounter a lion. What would be your reaction? What would you do?
Run.
Run. But if you are brave, you may choose to fight, isn't it?
Yeah.
If you have a gun, or if you have a dagger, sword, or whatever, and you are brave enough, and you have nowhere to hide or nowhere to run, the second choice you may choose to fight. Okay. So you have two options, no third option. Either you run away or fight. Just keep in mind then what is required in both these situations, either to fight or to run away. What is required? Just keep in mind, we'll discuss after finishing autonomic nervous system. The body has provided you with some valuable tools, mechanisms to cope in those situations. Not exactly to fight with animal, lion, those situations, the stressful situation. Okay. Organization of nervous system, actually, it is more in the context of neuroscience and block, which will come in semester 4. But briefly, in the context of autonomic nervous system, I will discuss something. Organization of nervous system, central nervous system, which consists of brain and spinal cord. And then peripheral nervous system, which consists of anything which is outside the brain and spinal cord, peripheral nerve, ganglia, whatever it is the peripheral nervous system. So this is the organization, this brain and continuation of brain, spinal cord, this is central nervous system, and everything else around it, outside, it is a part of peripheral nervous system. In today's context, we are concerned more with peripheral nervous system, not central nervous system, which will be dealt in detail in semester 4. Okay, so peripheral nervous system, we have two limbs, efferent and efferent. Efferent means a sensory part, where you actually carry the impulses. The peripheral nerves carry the impulses from the rest of the body through peripheral nerves, and they travel to the central nervous system, spinal cord, or at the higher centers later on. And then based on what response should be evaluated for time or other situations, what should be the response of your body? Efferent, sensory, efferent, motor, away from the central nervous system. So once again, in today's context, we are concerned with the efferent system. So efferent system, motor system, the message is carried from central system to the periphery, motor, which is motor, is divided again into somatic and autonomic nervous system. Somatic means that whenever the things are under your voluntary control, pure decision. It is pure decision. For the case of man, you regulate, you fight, you create a puzzle, fight, regulate, you so your decision, your control of running, everything, it is under your control. Other things which may help your decision may not be under your control. That's a decision. Yeah, that's it. Waiting. They are not under your control. Proper direction. They will be under the control of autonomic nervous, which are not under your conscious control. Somatic nervous system is under your conscious control. You decide to move here in this direction or in that direction, but your heart rate is not dependent upon your decision. It will continue to control whatever the situation demands. That is autonomic nervous system. So today we are more concerned with autonomic nervous system. And autonomic nervous system again is divided into two limbs: parasympathetic nervous system and sympathetic nervous system. I think in the biology of high school, you must be familiar with these terms, aren't you?
Yeah.
Do they teach? Okay. So parasympathetic nervous system and sympathetic nervous system, we will discuss those in detail. So difference between somatic, as I mentioned, somatic innervates skeletal muscles, which are under your control. You decide. And autonomic nervous system, ANS supplies smooth muscles, cardiac muscle, and glands. secretions, cardiac muscle, not in control. One neuron between CNS and effector organ in skeletal muscle, somatic, whereas in ANS has a neuron connected by a synapse between CNS and the organ that is known as ganglia. Ganglion between the effector organ, which is supplied, and the nerve arising from the CNS. In between, there's a connection, synapse. That's the ganglia. And another difference, in somatic, efferent arises from ventral horn fin, and this is anatomic difference. And in ANS, efferent preganglionic arises from lateral horn fins of the spinal cord. We are talking about the spinal cord. And in somatic, the neurotransmitter, which carries impulses, which is the actually chemical, which is responsible for transmission of impulse from one neuron to another neuron, or from neuron to the effector organ. In this case, what is the effector organ? Skeletal muscle. Muscle. Because we are talking about somatic. Skeletal, that is acetylcholine. Effector organ is acetylcholine. In case of autonomic nervous system, there are two neurotransmitters, depending on parasympathetic or sympathetic. Can be acetylcholine, can be noradrenaline. So these are the fundamental differences between somatic and autonomic nervous system. The skeletal versus smooth muscle, you can see, as I mentioned, there is only one neuron in skeletal muscle coming from the spinal cord directly innervates the skeletal muscle, and the neurotransmitter here is acetylcholine. And in case of autonomic nervous system, say for example, smooth muscle or gland or whatever cardiac muscle, the first neuron arises from the spinal cord, synapses in the ganglion, another neuron arises, and here it ends into the effector organ, be it smooth muscle cell, be it gland, be it cardiac muscle, whatever it is, there are two neurons are here. This is known as preganglionic neuron, rather it comes before the ganglia, after synapse. Another neuron arises, that is postganglionic neuron, and ends in the effector organ. The neurotransmitter may change. Here, we'll discuss. Anything? Any question? No? Clear? Let's move. Good. Key points. The somatic nervous system is a part of the peripheral nervous system associated with the voluntary control of body movements through the skeletal muscles and mediation of involuntary reflex arc. The autonomic is a part of the PNS, that is peripheral nervous system, that controls visceral functions that occur below the level of consciousness. You become aware something is happening, for example, heart rate, but it is not under your control. You can't control. And sometimes you may not be aware. Sometimes you may not be aware what is happening. The ANS can be subdivided into parasympathetic and sympathetic, as I mentioned. Now see here, this is very complicated, but I will try to make as simple as possible for you in the coming slides. On the left side, it is a sympathetic nervous system. You can see the functional organization of sympathetic nervous system. And parasympathetic on the right side. Please raise your hand from the back. Can you, from this figure, can you figure out the differences? Anybody? Not here. On the left side, it is sympathetic nervous system. On the right side, it is parasympathetic nervous system. Based on this figure, can you figure out some fundamental differences? Higher means okay. It is motor one. It arises from the higher sector. Okay. And sympathetic arises from the but parasympathetic also arises from S to S, lower part of it. So higher and both and sympathetic from okay, very good, thank you. So you can see, so that is why sympathetic nervous system is known as the thoracolumbar. Then we this is spinal cord. From each level of spinal cord, from the vertebral column, here is a pair of peripheral nerves. emerging from the vertebral column, peripheral nerve. So each peripheral nerve is named according to the root. Where it arises. So, yes. So from the thoracic part and lumbar part, those sympathetic nerves arise. They are sympathetic nerves. And you can see the parasympathetic, they arise from the hair center, cranial nerve. You will see many, you will learn in universal nerve. There are various cranial nerves like the glossopharyngeal nerve, or autonomic nerve, which arise from the brain itself and then sacral part. So this is known as cranial sacral part, and this is known as thoracic lumbar part. Yes.
That's two ganglions. That's one.
No, both one, each one has one ganglion. Yes. You see, after arising, each one has the difference is the ganglia for the sympathetic nerve. I will explain later on. So now, this point. The ganglia for the sympathetic nerve is immediately after coming out of the spinal cord. There's a sympathetic chain. Sympathetic ganglia arranged in clusters immediately outside the vertebral column on both sides. Those are, as soon as the nerve fiber comes out of the spinal cord, that means the pre-ganglionic fiber is sharp. And then the post-ganglionic fiber arises from the sympathetic chain and it continues till the end of the chain of organs, where it wants to. There's the post-ganglionic fiber, that is why very long. And the pre-ganglionic fiber is very short because it comes and synapses in the sympathetic chain as soon as it comes out. So these are the sympathetic chain. These are pre-ganglionic and these are post-ganglionic. Post-ganglionic are not.
What's the dots?
Uh,
The right side.
Here,
The one right.
here,
Uh,
which one? Okay, they're going to give you the later on. Just hold on. I should, since you raised this point regarding the parasympathetic, I had mentioned that we have the here. And the parasympathetic fibers, they also have one ganglion. But the ganglion is just before the sacral organ. So the pre-ganglionic fiber is long and the post-ganglionic fiber is short. Okay. So it will be clear. Hold on. Key points. Sympathetic and parasympathetic systems typically function in opposition to each other because one key point which you missed here, you didn't mention. One is the anatomical distribution, cranial sacral, another key point is almost all the organs which are not in your control, conscious control. They have a dual innervation. They are supplied by both organs of heart, supplied by both parasympathetic, specific lungs, supplied by parasympathetic, almost all organs are supplied by both parasympathetic and sympathetic. Dual nerve supply of all the autonomic organs. From this, you can conclude that sympathetic and parasympathetic nerve system typically function in opposition to each other, generally speaking. Didn't I mention in my first lecture on functional antagonism? Histamine, antagonism, histamine, anaphylaxis, and sympathetic and parasympathetic nervous system. Generally speaking, they work in antagonism to each other. This opposition should be viewed as complementary in nature. In the sense, rather than antagonistic, for an analogy, you may think of the sympathetic division as the accelerator and the parasympathetic division as the brake. Okay. The sympathetic typically functions in actions requiring quick responses. The parasympathetic functions with actions that do not require immediate action. Differences, once again. Origin, peripheral, sympathetic, cranial sacral, parasympathetic, as I mentioned, as was evident in the figure. Pre-ganglionic fiber, sympathetic sharp, because the ganglion is there as soon as the nerve comes out of the spinal cord, short pre-ganglionic fiber, there is a parasympathetic. The ganglion is just before the effect arm. So the pre-ganglion fiber, in the case of parasympathetic, is long. Ganglia located away from the organs of innervation because they are just outside the spinal cord. And in the case of parasympathetic, it is located very close to organs of innervation. Are you getting this point?
Yes.
Post ganglionic fibers, since they are very close, ganglia close to the origin, the post ganglionic fibers are long. In case of parasympathetic, since ganglia are very close to the effector organ, the post ganglionic fibers are short. The response to stimulation, generally sympathetic, diffuse, generalized, all of a sudden, everything, every thing in the sympathetic nervous system is activated, depending upon the situation. Immediately, I will go to that figure of Diane and I will explain later on. Sympathetic nervous system. And in case of parasympathetic, it is localized. One by one. And neurotransmitter in sympathetic, you can figure out in all the cases it is acetylcholine. Preganglionic, sympathetic, preganglionic, parasympathetic. Both of them. In postganglionic, at the level of effector organ, it is norepinephrine in case of sympathetic, in case of parasympathetic, it is acetylcholine. Do you have prior knowledge about this or all these things new? Important function, trickling, stress in emergency, and parasympathetic assimilation of food and conservation of blood. There is one fundamental difference in case of post-ganglionic fiber in sympathetic nervous system. There is one exception where the neurotransmitter is not Fat glands. I will explain later on. There is one exception. Let's move. Parasympathetic versus cholinergic and sympathetic versus adrenergic. Here you need to know the fundamental differences. What is cholinergic neuron? Yes, a neuron which synthesizes and releases acetylcholine as a neurotransmitter, which releases acetylcholine as a neurotransmitter is cholinergic neuron, as the name indicates. Now the $1 million question is, would you call parasympathetic nervous system a cholinergic system?
Yes.
Would you?
Yes. So there's only one way.
That is there in the sympathetic, not here.
Yeah.
Okay.
This is all.
So it is synonymous. So parasympathetic nervous system is basically a cholinergic system. Clear? Any question? Hello? From the back benches who are busy with laptop and mobile phones? Are you understanding? Are you listening? No? There should be ban on recording so that you cannot listen later on. What is an adrenergic neuron? The neuron which releases norepinephrine as a neurotransmitter. The next question is, would you call sympathetic nervous system as an adrenergic? It is not. Most of the time it is true, but except one exception, which is fat glands, where sympathetic fibers to fat glands are cholinergic. Okay, so that is the exception. Otherwise, it is synonymous. So summary of the neurotransmission, let's now summarize all things, then we will move further for the transduction. Parasympathetic nervous system, preganglionic neuron, acetylcholine, postganglionic neuron, acetylcholine, etc. Very simple. Clear? Sympathetic nervous system, generally speaking, preganglionic fiber, acetylcholine, postganglionic neuron, norepinephrine, generally, and that exception is here. Okay? Clear? That's the exception. And sympathetic nervous system, there is one more exception. Adrenal medulla, because there is no any post-ganglionic fiber. As soon as the pre-ganglionic fiber goes to the adrenal medulla, there is a hormone. Okay, so there is epinephrine, various organs. And then we have another branch, which we will discuss anyway in my third lecture, cholinergic endocrinology, which is about the somatic nervous system. Why we, although it is not autonomic nervous system, but we will discuss anyway. The reason being the main neurotransmitter in somatic nervous system is it has to be discussed anyway. So somatic nervous system, can you see any pre-ganglionic or post-ganglionic? No. In somatic, there is no ganglion right away from the peripheral nerve. There is acetylcholine, and it is under voluntary control. Contraction of muscle is brought about by acetylcholine. Clear? Now, life cycle of acetylcholine, you may ask, why should we be interested in life cycle of acetylcholine? Because see, there are several drugs you will see, we'll discuss. They manipulate those various steps in the synthesis, release, uptake, metabolism of acetylcholine and norepinephrine. So they are important targets of various drugs. Now, this I take it from Lippincott. The first step is synthesis of acetylcholine. Choline and acetyl-CoA, they are both joined together under the influence of several enzymes, choline acetyl transferase and others. And acetylcholine is synthesized, which is in the next step, is stored into the storage vesicles in the cytoplasm of the cholinergic neuron. Once it is stored, it is there. It is released as soon as an impulse arrives. Cholinergic neuron is stimulated, is depolarized, and then in the third state, there is a release of neurotransmitter as a result of exocytosis. There is burst of cell membrane, and acetylcholine is released into the quanta into the synaptic cleft. And depending upon the effector organ, it may be a synapse, as in the case of pre and post ganglion, or it may be an effector organ right away, directly. Anyway, acetylcholine is released as a result of stimulation of cholinergic neuron. Third, fourth step is important. It will bind to its receptor. There are various types of acetylcholine receptors. We'll discuss in the subsequent slides. After binding to the receptor, there should be some fate of the acetylcholine. It can't be there for your whole life. It can't be there on the receptor for your whole life. It has to be removed. And there are some mechanisms to get rid of the acetylcholine from the synaptic cleft. One is degradation of acetylcholine. There are enzymes like acetylcholine esterase, which degrades acetylcholine, and choline recycled back and then transported back and recycled, and some is taken by the extracellular fluid and excreted, degraded. And the last step is recycling. Choline is taken back, transport mechanism, and recycled. So all these steps you need to know, because in each step you will find some very useful drugs which modify the action of cholinergic neurotransmission in several steps. Clear? Now, cholinergic receptors. What are the receptors? We discussed stage number 4. Here. In this cartoon, there's only one receptor, but there are various. What are those? Muscarinic and nicotinic receptors. Nicotinic receptors and muscarinic. Nicotinic are further divided into N, and N. N stands for muscles. They are the skeletal. And N are mainly the ganglia. You remember all pre-ganglionic fibers are cholinergic. All pre-ganglionic fibers are cholinergic, and over there the receptors for acetylcholine are N. And some N are in the brain also. And muscarinic receptors are 3 types: M1, M2, and M3. And this is their localization. CNS, gastric secretion, or smooth muscle and various planes. M1, M2, and M3. Any question? Now see the effects. Now this was the localization. Now let's discuss some effects of what happens when muscarinic receptors are activated. Acetylcholine acts at muscarinic receptors, and what happens? As a result of activation of M1 receptors in the gastric glands, there is increased acid secretion, HCl secretion. That is why anti-muscarinic drugs, they decrease HCl secretion and they can be used to treat peptic ulcer. Okay, and CNS, they are not major effect learning and memory. In M2, they are in the SA node, which is the pacemaker. So it is under the parasympathetic control, mainly parasympathetic control. So when the M2 receptors in the SA node are activated, that will cause decrease in heart rate. Decrease in heart rate. And AV node, decreased velocity of conduction, and in the CNS, activation of M2 receptors causes tremors. That is why anti-muscarinic drugs are very, very useful in treating the tremor associated with Parkinson's disease. You will learn in neuroscience. There is a tremor in Parkinson's disease. So that is very good drug. Anti-muscarinic drugs are very good to treat that. And M3 receptors in smooth muscle, when smooth muscle is innervated by M3 receptors, there is a contraction. And iris constriction of pupil, ciliary muscle contraction, and exocrine gland secretion. All these actions happen when M3 receptors are activated. Now, actually, I should have written this one in the first row because this is more relevant. Receptor type, all are G protein coupled receptors. I mentioned in my first lecture, no, in the lecture of pharmacodynamics.
Yeah.
G protein coupled receptors. Whenever there is a G protein, GQ protein that is coupled with PLC, phospholipase C. Phospholipase C is causes the hydrolysis of PIP2, leading to generation of two second DAG and IP3. So DAG and IP3 are generated as a result of GQ protein in M1. That is why you will see the acid secretion and other actions which require calcium. Calcium because IP3 causes increase in intracellular calcium as a result of release from sarcoendoplasmic reticulum, GQ protein. These are fundamental concepts of physiology and pharmacology. Now, this one, M2 receptors are under the influence, I mean, they are coupled with GI protein. GI protein means decreased cyclic AMP, coupled with adrenaline cyclase, decreased cyclic AMP. So everything will be slowed down. Heart rate will be slowed. Conduction velocity will be slowed because it is coupled with GI. GI means decreased cyclic AMP. And increased cyclic AMP in the cardiac muscle or pacemaker will cause increased heart rate that you will see later on the adrenergic receptor. Beta receptors, increased cyclic AMP, GS protein. And M3 receptors, once again, GQ, IP3 dies, so you will see smooth muscle contraction means requiring calcium. Glands requiring calcium. Everything is calcium dependent for GQ protein coupled. Yes.
Is that mostly found in synthetic?
No, it's here parasympathetic. We are talking about parasympathetic. We are not talking about sympathetic.
One and two. But it was
No. Those are public. These are all muscarinic or physical cholinergic, not adrenergic. These are muscarinic. A stands for muscarinic. Parasympathetic. We are just now dealing parasympathetic nervous system. Okay. Nicotinic receptors, as I mentioned, two types, NN and NM. So in NM, neuromuscular junction, depolarization and contraction of the skeletal muscle, and N in autonomic ganglia, adrenal medulla, and CNS excitation. That is why after smoking, one feels excitation. Nicotinic receptors in the CNS are stimulated that lead to excitation, euphoria after tobacco smoking. And in this case of nicotinic, the receptors are coupled with ion channel. Didn't I mention in my pharmacodynamic lecture, some receptors are coupled with ion channels, and this is the classical example. Ion channels here are opening up sodium, mainly sodium and potassium channel, and in both cases, sodium and potassium channel. Nicotinic receptors are coupled, they are not G protein coupled receptors, they are coupled with ion channel. Okay? Now let's move to the sympathetic arm of the autonomic system. Now we are coming to the sympathetic. Epinephrine, similar to acetylcholine. First step, synthesis of norepinephrine from dopamine. Uptake, similar, and storage vesicle. Release, as soon as the adrenergic neuron is stimulated, there is the release of norepinephrine in the synaptic cleft. Fourth, same action at receptors depending upon the site, which receptor there, alpha, beta, which subtype, we'll discuss later, receptor. And then fifth is removal of neurotransmitter from the synaptic cleft. And there are various mechanisms, catecholomethyltransferase transferase, like that, and metabolism, monoamino oxidase, catecholomethyltransferase. These are once the neurotransmitter is there after producing an action, the neurotransmitter has to be removed to terminate its effect. And there are various mechanisms. But this is the typical life cycle of all the neurotransmitters. Any question? No? Yes. You want to ask something? No? Okay. Now receptors, like cholinergic receptors, adrenergic receptors are of mainly two types. What are? Alpha and beta. Okay. Alpha are again divided into alpha 1 and alpha 2, beta, beta 1, beta 2, and beta 3. Okay. One by one, signaling mechanisms. Alpha are coupled with G. That means similarly, like M1, PLC, IP3, then alpha 2 are GR. Inhibition of adrenal cyclase, decrease in cyclic ANP. Beta 1, all beta are coupled with GH, means increase in cyclic. So based on the second messenger, you can figure out if there is an increase in cyclic in the cardiac muscle, the pacemaker cells, there will be increase in the heart rate. In the previous case, M2 receptors, they were through GI, increase in heart rate. They are opposite to each other. So this is the signaling mechanism of alpha and beta receptors. The response of stimulation of alpha 1 receptors. Now see, alpha 1 receptors are coupled through GQ, increase calcium, increase J, increase IP3, increase calcium. Now you can figure out blood vessels, vascular smooth muscle, contraction of the smooth muscle will lead to the increase peripheral vascular resistance, increase blood pressure. Vascular smooth muscle, contraction because of the calcium. Okay. Increase peripheral vascular resistance, increase blood pressure. Radial muscle, contraction, calcium. GIT spectrals, contraction. Urinary bladder tripoline spectrum, contraction. Vast difference. HIP once again, contraction. Liver, glycogenesis. All these actions are to alpha 1. Alpha 2, this is very interesting story. Alpha 2 are just like brake. They are present in the presynaptic nerve terminals and they decrease transfer. What is the signal mechanism? What is the G protein for alpha 2? GI means decrease Is there marker? Can I draw figure?
Yes.
You can marker. Yes, yes, can I? I can draw it.
Yeah.
This is the neuron, tetracentric neuron, and these are postsynaptic receptors, the alpha 1, beta 1, beta 2, beta 3, whatever they are. And our epinephrine is it takes on the receptors, what the figure I mentioned. There is another compensatory mechanism that nature has provided with alpha 2 receptors, the localization of which is very synaptic. They are present on the same neuron from where the norepinephrine was released. That is why we call them, what is written here? Presynaptic nerve terminals. Presynaptic nerve terminals. When they are the same neurotransmitter, it's on the postsynaptic receptor, and it also acts on the presynaptic alpha 2 receptors, which act as a brake to inhibit further release of norepinephrine. Further release of norepinephrine. So alpha 1 receptors are postsynaptic, alpha 2 receptors are presynaptic. Activation of alpha 2 enhance actually decreases the further release of neurotransmitters from the neuron. Any question?
That's another question. So alpha 2 would decrease the action of alpha 1.
Exactly. They will not decrease the action of alpha 1, they will decrease the release of norepinephrine. Eventually, there will be sympatholatic indicator. Okay, let's move. So we discussed alpha 1, now beta 1. We discussed both alpha 1 as well as beta alpha 2. Now beta 1, they are coupled with which protein? GS. Increase cyclic AMP. Increased cyclic AMP will increase heart rate. Okay, it will cause increased conduction velocity, increased force of contraction in the heart. Beta 1 receptors are mainly in the heart, and the kidney renin release in ciliary epithelium aqueous humor production. That is why beta receptor antagonists are very useful drugs in the treatment of an eye condition which is associated with increased humor production, glaucoma. Okay. Now, responses to stimulation of beta 2 receptors. Beta 2 receptors are coupled with once again GS, cyclic AMP, increased cyclic AMP in the smooth muscle. Cyclic AMP. We are not talking about calcium. Calcium contraction, cyclic AMP, relaxation. Smooth muscle, bronchial smooth muscle, uterine smooth muscle, relaxation. Drug of choice in the treatment of asthma, beta 2 agonist. Blood vessels to skeletal muscles, vasodilatation, blood vessels to skeletal muscles. Feel the difference. In the alpha 1 receptors I mentioned, blood vessels. Here, blood vessels to skeletal muscles. They are dilated. The distribution of alpha 1 receptors is in all the muscles, all the vessels, except blood vessels to the skeletal muscles, which have beta 2 receptors, which dilate. Uterus, relaxation. That is why you give beta 2 agonist when there is a preterm labor pains. Preterm labor pains, you want to postpone the delivery. You want to postpone the delivery, you give beta 2 agonist to relax the uterine muscle. To relax the uterine muscle. In the bronchial smooth muscle, relaxation, drug of choice in the treatment of asthma. Liver, glycogenolysis, ciliary epithelium, aqueous humor production. Yes.
The same action as the alpha 1.
Yes, both are complementary here. They are not antagonistic. They are complementary.
Right.
Both are complementary here. Responses to stimulation of beta 3 receptors, they are not well distributed throughout the body. They are simply adipose tissue. They enhance lipolysis and thermogenesis in cold weathers. Okay, that's it. Now summarizing the effects of sympathetic and parasympathetic on the effector organs. Now I'm not going to into detail. We already discussed everything. Just want to revise this thing. Now you have two options. Run away or fight. In both situations, you need now look at the sympathetic nervous system. That is why, before looking at here, let me tell you, in the textbooks you will find a sympathetic nervous system is called the nervous system of flight or flight. Fight or flight, like in run away. In both cases, in emergency, a stressful situation where your quick action, generalized action, body reaction is required, either to cope with running or fighting. All these actions, look at the sympathetic nervous system, dilatation, better focus, salivation, thick mucus secretion, the mouth dry. Drainage secretions increase. Why? To increase cardiac output. To increase cardiac output. Beta 1 receptor. Beta 1 receptor. Content increase. To increase cardiac output. Supply blood to the essential organs like the beta 1 receptor. Bronchodilation. Beta 2 receptor. More oxygen required. More oxygen required to either fight or run away, whatever. Beta 2 receptors, bronchodilation. GIT decreased motility. Why? Decreased motility. Because during that crucial time, you may not do something which actually later on you will regret. Your excreta should be under your tight control. Okay, smooth muscles and excreta. So secretion of renin. Same thing with urinary bladder, relaxation, contraction of excreta. Your urination should be stopped. Male genitalia not under stressful condition. Uterus relaxation, blood vessels constriction because skin and viscera they do not require blood during that stressful situation. Alpha 1 receptors are activated. Alpha 1 receptors are activated during stressful situation. So because skin does not require blood during that time, that blood should be diverted more towards skeletal. Which receptors? Beta 2. Remember, make the connection. Make the connection. Alpha 1 receptors, generally I told you that blood vessels, smooth muscles of the blood vessels are supplied with alpha 1 receptors, which are coupled with GP protein vasoconstriction. But blood vessels to the skeletal muscles, beta 2 receptors coupled with GS protein, cyclic AMP, relaxation, vasodilation. So during a stressful situation, you require more blood to skeletal muscles, not to the skin and arteries. In that case, beta 2 receptors are activated, alpha 1 receptors are activated, blood is diverted from other organs towards the skeletal muscle. Okay? So adrenal medulla, pilo-erector muscles contraction, you have seen whose skin. During the stressful situation, your hair become erected, pilo-erector muscle. So what will you do? Whatever you do, fight or flight, you need activation of sympathetic nervous system, and all these actions go complementing each other to increase your cardiac output. Yes.
Which sequences are for the blood vessels that go to the skeleton? Constriction.
So in that case, generally, that is interesting. The interesting is generally blood vessels to skeletal muscles. It is auto, you see, it's a autonomous regulation. Whenever the skeletal muscle requires more blood, beta receptors are stimulated. When you do exercise, beta receptors are stimulated. Otherwise, it's resting level, they are not stimulated. Autonomous. Whatever the skeletal muscle requires. Okay, so that's it. I hope you understood, and from now onwards, many lectures will be on this thing. Have you observed something I have observed here, this system? For the first time when I tried to log out, log in, I never. Second attempt, although I'm sure I put the right password, does it happen with others also?
Yes.
Always, in the second attempt, I'm successful, first attempt is not successful. Some bug here?
It happened with other doctors.
Yeah.
Why did I do this? Okay, let me count. The girls, the study I saw, they cheated. Okay, 65.
Some of them is right.
Why isn't the preganglionic fibroblasts different? They're activated by a
Why?
Which is that they're only
Why? Do not answer why. I don't know why. What is in there? I don't know.
allergic to liquid.
When you get that, I'll always tell you. Why? I don't know. Very clear.
Doctor, I just have a question about the beta receptors.
Just a moment. Yes.
Why do beta receptors cause a contraction of the heart and increase heart rate? And also, on the other hand, they cause vasodilation of the muscle.